This is the first of the safer drug consumption facilities to be available in the United Kingdom, and it's here in the city of Glasgow, and it's been a consequence of tenacious work that's been undertaken by various organisations in Glasgow to make sure that we've got every intervention available to us to try to advance on our national mission on drugs. The Safer Drugs Consumption Facility will enable people who were always going to take drugs to be able to do so in a safer clinical environment, but also to have access to support and advice and counselling to help them to choose a different pathway in life.
And what sort of tangible difference do you hope that a facility like this will make?
I hope it will help us to reduce drugs deaths in Scotland and to help people to find a different route in their life. So we will evaluate the effectiveness of this particular intervention to determine what progress is achieved as a consequence of it, what impact it's had, and to learn the lessons from that.
Mm-hmm. And the facility here has been delayed a few times. It was meant to open sort of late last year, so it now means that the National Records of Scotland drug deaths figures will not be able to cover the impact of this summer, but we'll have to wait till next year till we find that out. How will the government be monitoring sort of on a more regular basis, and when can we expect a final decision on whether this is deemed a success?
It will obviously look at all of the published information that comes out. There'll be, I would imagine, there'll be regular evaluations of the progress that is made here, and that will be able to be seen transparently. The government will obviously look at a range of different interventions that are made on drugs deaths to ensure that we are doing everything we possibly can do to address the entirely unacceptable level of drugs deaths that we have in Scotland today.
Mm-hmm. And what would be a measure of success? What would be enough for the government to say that this pilot has been successful and we should open these now in the rest of the country?
I'm not going to set out any targets or any measures. We will see the effect of this in the data and the evaluation that comes forward, and that will be subject to open and public scrutiny. I think on the question of whether or not there are any other such facilities in any other parts of the country, first of all, I think that has to depend on an evaluation of the effectiveness of this measure, but it would also have to depend on any judgment applied by the Lord Advocate in relation to the prosecutorial guidance, which is an independent matter, independent of me, and the Lord Advocate would have to be able to exercise that function independently in relation to any other centre.
And this facility is aimed at injectable drugs. Obviously, we see the booths behind us. But one of the big threats that we've been warned about for the last sort of 18 months is these nitazines, these synthetic opioids, which are largely in pill form. How is the government trying to combat that, which seems to be creating a lot more havoc on the streets than things like heroin are?
There's obviously, we've got to be alive and alert to the changing dynamics of drug use within our society, and to find every intervention we possibly can do to ensure that those don't become significant factors in our experience around drugs. Now, the synthetic opioids is a real threat, and there is sustained work being undertaken to ensure that we reduce the risk and the harm that can be caused as a consequence, but we must be constantly vigilant about the steps that we can take to do that.
And just finally, what would you say to those that are pushing the government to provide more residential rehab beds rather than to provide a place for people to safely take drugs?
What I'd say is that we've got to take a range of different measures to address the level of drugs deaths in Scotland today. So we are expanding the number of residential rehab beds. They've gone up by 20% to 513 just now. We've got a budget before Parliament that will further expand those services around the country. And there's a range of other interventions at community level which are designed to support the work that we're taking on drugs. So what I would say is that this is one aspect of the approach that we are taking. In my view, it's a welcome intervention to try to help us on that journey, but there will be a range of other interventions that we have to take, and we are taking.